It's happening to us more and more now, myself included. That's why I wanted to share this video with you. What to do if you are denied a test or procedure by your insurance company. What can you do to make sure that, number one, you get the procedure that your healthcare provider recommends, but also how to um, file an appeal if needed. Earlier this month, I received a letter from the insurance company that I am a member of, indicating that they have decided to not pay for a lab treatment that was ordered by my specialist physician. This procedure has been ordered by this physician's predecessor. My doctor recently retired, so I'm starting with someone else in the new department who is great. Anyway, she ordered another test to ensure that the levels of the medication that I'm on were at the right marks where they needed to be. Anyways, the insurance company said that test was deemed medically unnecessary. Decided to not pay. Um, the physician's office appealed to them. They decided that they're still not going to pay. So that leaves me stuck with a $700 bill. And if you're in a situation like that, I'm sure you would be upset as well. So I'm going to talk to you a little bit about what we're doing to go through the process and make sure that we get our due process in this healthcare system. When you're faced with a situation like this, one of the first things you want to do immediately is get on the phone with the healthcare provider. And I would say, when I say immediately, I'm like within the next first 30 to 60 days, and get on a payment plan. And the reason why is healthcare providers have gotten more aggressive in sending their outstanding pay bills to collections. So you don't want to get put in with collections, because that opens up a whole nother can of worms. So you want to try and get on a payment plan, the lowest amount possible that they will allow. While you're on the payment plan, this will give you time to do the research for your appeal. You should ask your doctor's office for help. Ask if they have any medical journal articles, for example, that can help your case. Has this procedure been ordered more? I've had to go through this several times. One thing that has been helpful for us as we've gone through it is, if a procedure or a treatment was on a different insurance company at the same amounts, you show that to the new insurance company, and it's really hard for them to argue with that. Next, you're going to want to also, if you needed, request what's called a peer-to-peer. So that would be your doctor talking to the doctor or nurse at the insurance company. They create what's called utilization departments in these companies. It's a way that they are trying to drive down costs, but as a result, it affects us and can potentially keep us from getting care that we need. So that's why you want to have a peer-to-peer, where your provider can tell them exactly why this is an important treatment or test for you. That should solve the problem, but if it doesn't, you can file an appeal with the Department of Insurance, which is possibly what we might be doing here. In our state, we have within 6 months of the denial to do that. So we are in the process of putting together a letter, compiling all the documentation and journal articles on this matter for my case. So these are some of the ideas that I wanted to share with you that you might be able to use as you're going through another similar situation. Of course, you can always message us if you need help with this, if you need someone to help guide you through this. And if you like this video, please share it and request more by subscribing to our page here below. And don't forget to give it a like as well. And we will see you on the next video.